As the opioid crisis kills more and more Canadians, 6 MPs reveal how addiction has touched their lives.
Opening the door and seeing her there, she didn't look like my kid, didn't look like my daughter.
Some call for more safe injection sites and more safe supply.
You need to keep them alive.
Others want way more treatment beds.
I have a brother that's currently on the streets. If only there was a bed. I remember the conversation with the social worker.
These MPs sat down with Catherine Cullen, host of CBC Radio's The House, to break down how their politics are shaped firsthand, often by painful experiences.
Gord Johns, NDP, the riding of Courtenay Alberni. It's just constant. I'm afraid to check my phone because I'm worried I'm going to get another message about somebody else who's died.
John Barlow, Member of Parliament for Foothills, Southern Alberta, Conservative Party. It happens to real people. It happens to normal people. And it happens to people that you would never expect it to happen to.
We lost 4 people in 1 week, and we knew them by names. My name is Ariel Kaibaga. I'm the Liberal Member of Parliament for London West.
I'm Jenny Kwan. I'm the Member of Parliament for Vancouver East for the NDP. With what other health condition would you think is normal to know that people are dying to the degree that they are today, that you think we're not going to do everything we can to stop that from happening?
I'm Todd Doherty. I'm the Conservative Member of Parliament for Cariboo Prince George. We have to do something. I don't have all the answers. I just know that something has to be done.
I was in Vancouver at the airport and I took a phone call and I found out about 2 young boys, 17 years old, that had died together from toxic poison drugs. And I knew one of the boys. He was in and out of the child welfare system. He was a friend of my son's. I'd watched this young boy grow up, and he didn't have a fighting chance, and just the feeling, the overwhelming sense of pain from his loss. I think part of it was guilt, like the colossal failure of all of us to tackle this crisis, to respond to it, and to prevent people like him from dying. Like it was probably one of the toughest times.
I have a brother that's currently on the streets, has been on the streets for going back to the 90s now. Gripped in this epidemic. My brother, here's a guy that, a kid that was the youngest out of a family that, where dysfunction and abuse kind of perpetuated our daily lives. I've gone into drug houses. I paid his debt off with bikers and the drug dealers. We pulled him off of a bridge in the middle of the night. We brought him into our home, scoured the streets in many cities in our province, trying to find him, to make sure he was alive. It's something else to look in dumpsters for your, for a loved one's body. Yeah, it's something else.
Patty Haidu, Member of Parliament, Thunder Bay Superior North, Liberal Cabinet Minister. Prior to this work, I ran a large homeless shelter in Northern Ontario. I have witnessed people who have died of overdose. I mean, it's probably one of the most traumatic work experiences of my life, attending the shelter late at night where a young man lost his life. But I'll never forget the call to his mother. And they were not close. This mom asked me for help finding clothes to bury her child. They were living in a really desperately poor situation with no financial resources. And she was devastated that she had lost her son, and she deserved all the respect in the world.
For my wife and I, we went through this with our oldest daughter, and for us it was like a bolt of lightning. We had kind of lost track of her for a few weeks. You know, obviously as parents, you're phoning, you're texting, your Facebook Messenger, whatever you can do to kind of keep in touch. And finally, I drove up to Calgary, went to her apartment, and just pounded on the door for what seemed like half an hour till she finally answered. And I will never forget opening the door and seeing her there. She didn't look like my kid, didn't look like my daughter. It was the scariest moment in my life. Now, thankfully, I'm extremely proud of her, how she has recovered and is doing so well 8 years later. But at that moment, I thought I'd lost my daughter. I really assumed that I would take her to the hospital and they would immediately put her in a treatment program. But for the doctor to come out basically and say, yeah, she's overdosed on fentanyl, she's good to go, you can take her home. I couldn't believe it.
I remember in the early days, I participated in a rally in the community where in a local park, the Oppenheimer Park in Vancouver's downtown east side, and the community pegged it as the killing fields. And in those days, they actually planted 1,000 crosses. Each cross had a name on it. It was somebody's brother, somebody's sister, somebody's son, somebody's aunt, somebody's uncle whose lives been lost. And at that time, what were we fighting for? We were fighting for the government to recognize harm reduction, to bring in a supervised injection facility. Nobody wants their loved ones to have an addiction.
A friend of mine who I went to high school with recently passed earlier this year, and but he had actually been well for a number of months. He was starting his life. He got an apartment in one of our wraparound services. I remember helping his family get on the list, and it was the first day, actually, the first week that he got into his apartment. He must have lived there on Monday. From Monday to Wednesday, on Wednesday, he was found dead. What I learned from it is that it is a very aggressive disease.
If you say this is urgent, where's the plan? Where's the plan with a timeline and resources? They spent less than 1% responding to this crisis than they did on COVID-19. Why? Because of the stigma.
Make it easier for these people to get into recovery. It's frustrating. You know, as I said about my brother, I mean, he was saying all the right stuff. You know, if only there was a bed. I remember the conversation with the social worker. There's nothing available for him. So the only course of action was to release him back into the shelter, back onto the streets. We have to give people a chance. We have to fight for them.
I used to say at the shelter, when people come to the door looking for safe supplies, clean needles, you know, pipes that are clean, etc., what they're saying is, I still have hope I could get better. And if I get better, I don't want to have HIV or hepatitis C. That's a health-seeking behavior. And so if we reframe that as about, in the sense that that's a hopefulness that people have, we have to continue to be brave and bold in trying new things.
Dead people don't detox. So you can say as much as you want to say that recovery is the only option for you. And when you know that for a lot of people, that is not the option, at least not at that stage. It may be down the road, but you need to keep them alive.
What I experienced with my daughter, there was no treatment program for her to get into that right away. We had to wait, weeks. I feel we're just perpetuating an ongoing crisis and hoping that it resolves itself, right? If we just put a lot of money out there and put the safe supply out there, this will somehow solve itself. It's clearly not working. Clearly something else has to be done. What that solution is, I don't think there is a definitive answer, but gosh darn it, we have to start putting some effort into this. This cannot carry on the way it is.
So it was the host of the House, Catherine Cullen, who had those conversations with the MPs. And I'm so curious, Catherine, what struck you?
Adrienne, that these politicians would be so open about these difficult moments in their lives. Some of them have never spoken publicly about some parts of this, but they agreed to do it now because they want the urgency of this crisis to be understood. It also shows that there are policymakers that care very much about this issue, that they are seized with it. And even though there's certainly disagreement about what to do about the toxic drug crisis, they are united in their frustration about the number of people dying.
And so what is the federal government saying about its own efforts to confront this crisis?
Well, we interviewed Federal Addictions Minister Yara Sachs on the House, and she does insist that the government is, in her words, throwing everything they have at this problem. She pointed the finger at provincial governments when it comes to a lack of treatment beds, and when it comes to some of the more hotly debated options, things like expanding access to prescribed drugs through safer supply, or considering opening up the decriminalization of small amounts of drugs beyond BC. Sachs says the government will make those decisions based on the available data. Adrienne?
All right, Catherine Cullen, really interesting conversation. Thank you for that.
Thank you.
Now, this weekend on the House, Catherine is talking to the RCMP about stopping the drugs and the ingredients to make them from getting into Canada. So you can check out the House on CBC Radio 1 or wherever you get your podcasts. There is a new episode every Saturday. We're working on another story that's very much about families fearing for loved ones. Ioana Rumiliotis has been talking to families, including Canadians, with close connections to hostages held by Hamas. Here she is talking with a man whose niece, 2 nephews, and sister-in-law were taken from a kibbutz.
And you're continuing these efforts with that vision in mind because you won't entertain or don't want to think about the alternatives.
100%. I start every day thinking that by the end of the day we'll see them brought back, 100%. And when my kids ask me when are they going to come back, I say tomorrow. And they say, you say that every day, and I tell them I am going to keep saying that every day until we get them back.
Ioana also spoke with a mother racked with worry for her 2 daughters, aged 15 and 8. That is coming soon to The Breakdown. Now, coming up, in India, farmers are growing a crop again many haven't planted in decades.
They grow in our state with less water, no fertilizer, no pesticides.
Why millet is having a moment again. We break that down next. India promotes the return of a humble, ancient staple to take on superstars like quinoa and rice.
With less water, no fertilizer, no pesticides.
Millet is getting a marketing push.
And I know to get the youngsters know about it through beer.
But it isn't subsidized like other crops. Here's Salima Shivji, our South Asia correspondent, to break down the history and the high hopes for a potential superfood.
The day begins with a slow trek to the fields, raw and ready for seeding. In the heart of Maharashtra's farmland in western India, the humble millet is making a comeback.
It's Raji, finger millet.
And this is easy to plant, right? Easy
Yes.
to sow?
110 days.
Okay.
Yes.
It takes only a few months to grow the millets, he tells me.
जैसे कि millets में है,
These days, it's by far the best option, says Balu Gore, for us farmers to eat and to sell. It wasn't always the case. Once a staple in traditional Indian cooking, the unassuming cereal fell out of favor for decades when rice and wheat took over, buoyed by government subsidies.
So you're all millet farmers, yes?
It forced local farmers here to change their ways,
Who stopped farming millets?
giving up on the hardy millet their grandfathers had sown. Millets just weren't popular anymore, they say. We were losing money. That refrain echoes through the small farming village, where today millet seeds are handed out for free for farmers to try. Rice was where the money was, so everyone switched, farmer Kashinath Kole says. But now there's a shift back to basics, his young neighbor adds. People didn't realize the benefits, how much easier it is to grow millets, she says. The sustainable seed so strong it can grow on arid land that won't support any other crop, and it takes far less water. Out in the fields, the return to tradition also brings with it old tricks, passed down through generations of millet experts. Slicing onions and gently mixing them with the seeds, the pungent smell a surefire way to ward off ants and protect the millets until harvest time. Tradition isn't top of mind here at this pub night in bustling Mumbai, and yet millets are also the top attraction. The beer free-flowing and the result of an experiment. It's been made using sugar extracted from millets instead of malted barley, a conscious decision from the brewmasters who want to give back to local farmers and the environment.
As a craft brewery, we love experimenting and doing new things. They grow in our state with less water, no fertilizer, no pesticides. They're hardy crops, right? They grow naturally, but there's no demand for it.
Those gathered here want to change that mentality and add a bit of fun.
It's nice someone is actually trying to revive and let people get the knowledge all about it. And I know to get the youngsters know about it through beer.
The millet promotion machine is in overdrive across India and has been for months. The Indian government persuaded the UN to declare this year the International Year of the Millet. Officials hoping for a millet craze to catch on globally, much like with quinoa or kale. The healthy millet has been touted as a super solution, with the devastating effects of climate change bearing down on much of the world.
Climate change is really, it's a reality that's staring us in the face. I think going back to indigenous methods, especially when we're talking about millets, they used to grow in regions where other things would not grow.
And so they're multiplying in markets across India. The push to promote millets narrows in on health, economic, and environmental benefits. But some say the Indian government could be doing more than simply marketing millets when other grains have aggressive subsidies attached to them.
Subsidy would help for the farmers so that they stay competitive in their production area. So if without the subsidy, then perhaps they would have difficulty to make both ends meet.
For those farmers toiling in their fields, working every inch of the land, that would be a welcome relief. I'd love to grow millets instead of rice. The other farmers get such a good price for it, Balukade says. But I can't. I don't have the space for it in my field. Unable to switch to the once neglected millet seed that's suddenly back in vogue.
South Asia correspondent Salima Shivji tells us the millet movement could be catching on. There's expected to be a push for it at the COP climate conference later this month in Dubai. Now, coming up, a CBC reporter has her name written in the stars.
Last Thursday, I found out that an asteroid was named after me.
Owning a tiny corner of the cosmos, that is next in our moment. There she is, a senior science reporter with us here at the CBC. Nicole Mortellaro covers all things space, and she can be seen right there gazing up into an eclipse. But now, when she gazes into the sky, she can do so knowing there is a celestial object up there bearing her name. Nicole's very own asteroid is our moment.
Zoom in. There she is. Last Thursday, I found out that an asteroid was named after me. So it was called 20042, 1993 CK1, and now it is called 20042 Mortellaro. The Royal Astronomical Society of Canada, they put forth my name, and it was accepted, which was amazing. The asteroid is in the main asteroid belt between Mars and Jupiter, and it is 9.3 kilometers in diameter, and it takes 4.15 years to complete an orbit. I can't guarantee that it will not slam into Earth. No, I'm hoping that will not happen. Never in a million years did I think, when I was looking up at the sky when I was 8 years old after seeing a picture of Saturn from the Voyager spacecraft, did I ever imagine I'd be where I am today. I can point up to the sky and say, hey, that is, I'm up there, and our name is up there, and that means the world to me.
Nicole's asteroid is a big, fast beast. It moves about 17 kilometers per second. And you heard her say there that it's about 9.3 kilometers in diameter. As a way to gauge it, that's not far off the asteroid that killed all the dinosaurs, just so you know. For all of us here at The National, thank you for being with us. You can watch anywhere, anytime on the free CBC News app and subscribe to The National's YouTube channel. I'm Adrienne Arsenault. Take care.